Good afternoon. I'm excited to speak about the multitude of articles that we reviewed looking at advanced MR imaging. Primarily, the imaging that we looked at was diffuse weighted imaging, or DWI in the literature. This is a really exciting imaging modality, if not for a number of reasons in differential diagnostics or a deeper appreciation of functional neuroanatomy. The studies that were highlighted this week discussed at length this idea of tractography. Furthermore, a number of those articles discussed research being done on the human connectome. I'm excited about these different concepts within neuroanatomy because it changes the face of what the clinician sees when they're treating a human being in front of them. And it gives us an idea of how rich, complex, and variable neuroanatomy and neurophysiology are. I couldn't help but notice with the articles that we had that there were a number of trends when discussing limitations. One of the first and obvious ones in the field of medicine, anytime a new modality or a new treatment intervention is coming along, there's always a concern with cost. And I don't believe that's any different than what we're seeing at the inception of diffuse weighted imaging within research. The second question is always what exactly or how exactly are we going to utilize this modality? And that was a common limitation and discussion as well within the articles presented within this unit. The third one really tied into, for me, how variable and complex the human brain is, and in that the time it takes to utilize this modality. As such, I decided that I wanted to investigate a little bit further and see what articles were out there that really honed in or focused in on its usefulness. First, though, it was necessary for me to whittle down where exactly I wanted to look. And I have a particular interest in the functional vestibular system. Historically, that's been looked at as the peripheral nervous system, the adjoining cranial nerves, interneuron networks, and into the central structures that would be commonly known as parts of the brainstem, such as the midbrain and the pons, as well as getting into the motor relay system that is the cerebellum. I was particularly interested in the cerebellopontine angle. And furthermore, I was interested in seeing, and really where we're seeing a lot of research in vestibular rehabilitation is, how is the cerebral cortex involved in all of this? So my system is more of a functional vestibular central nervous system. The first article I found was a really cool article just establishing and trying to establish connections that make up the human corticovestibular network. And they found a couple of cool trends with this. Number one, they found that within the corticovestibular network, it tends to be a right-brained entity, and they saw that in human primates as well. But with it, and much more importantly, they found that there was a massive amount of intra-network communication and cross-network communication or bilateral communication within the vestibulocortical networks. What they argue with that is when we look at central nervous system injuries such as a stroke, it's a reasonably rare occurrence that we have vestibular issues, and it probably ties into the fact that we have a robust corticovestibular network. The second thing that's applicable to clinicians in treatment, especially vestibular rehabilitation, is this helps strengthen the argument of the usefulness that would be central compensation of the vestibular system. And these networks or tracts would stand in support of that. I found this to be a really important anatomic research study. But as is the case with imaging, we have to consider what all sorts of different types or settings or specifics are with that. And I was able to find an article related to that. The second article looked at 3 different advanced diffuse weight imaging modalities. And without getting into the nuts and bolts too much of it, They did single out one of them that is abbreviated TGSE blade diffused weight imaging modality. And they specified that one as it had really no issues in anatomic distortions and provided accurate measures when compared to a number of other modalities and even brain surgery. It was a really positive and useful imaging technique specifically within the family of that DWI imaging modality. Furthermore, they found it to be an extremely timely modality. They were able to get the slices of interest within 6 minutes, and that's incredibly useful for patients. When we look at imaging, we appreciate that MRI is a tool used in diagnosis. And I also had an interest in seeing how can we use DWI imaging or functional advanced imaging techniques in differential diagnosis. This particular study, and this last one that I'll have in this presentation, looked at differentiating between vestibular schwannomas, which are a common cerebellopontine angle peripheral tumor, benign in nature, and the much more rare forms of a variety of metastases within that same area. What they recognized is traditional MRI is unable to differentiate between these two. And the interventions between these two are vastly different. And so the ideal differential diagnostic test would be one in which, non-invasively, we're able to accurately, without distortion or error, differentiate between these vastly two different tumors. And in this study, they were able to do that. So they ended up utilizing diffuse weight imaging to differentiate between these two tumor types, and they were able to accurately do so. The measure that was of particular interest and was highly sensitive was volume of the tumor. So a measure of volume within that tumor, which they related to an increased microvascularity and what they termed cellularity. And in that, a metastatic tumor tends to have greater microvasculature, higher number of cells, a higher volume, and they were able to differentially diagnose between benign and metastatic tumors. Very important test. So, even though we're still at the inception of advanced imaging modalities and its usefulness, specifically in tractography, we can appreciate that it already has a usefulness and will continue to grow as a tool as we move forward. Please appreciate the references that I have, and thank you for your time.